The 2026 Medicare costs have all been released. In this video, we're going to show you what's changed and how that will affect you. Coming up next on Holy Schmidt.
Holy Schmidt!
There's been a lot of change in Medicare in 2025, from a big shift from Medicare Advantage plans to Medigap plans, all the way to increases in premiums, deductibles, copays, and maximum out-of-pocket costs. And we're going to cover all of that right now. In this video, we're going to cover the big changes to Medicare Part A, Medicare Part B, and Medicare Part D, and we're also going to discuss the big trends in Medigap and Medicare Advantage plans. Medicare Part A covers inpatient hospital, skilled nursing facility, hospice, inpatient rehabilitation, and some home health care services. Medicare Part A doesn't have a premium for 99% of you, and the reason is because of something called work credits. Work credits are basically quarters of credit, meaning that for every quarter you work and you pay tax on that quarter, you get a work credit. And you need 40 of them in order to get free Medicare Part A. This means that for most of you, the threshold is working for 10 years or longer. Now, many people work for far more than 10 years, and some people work for less than 10 years. And let me explain the difference, because the difference is huge. A lot of people will go to work and then they'll stay home and they'll raise their children. Now, this is not a problem under most circumstances, because if the primary earner or their spouse has 40 work credits, then there's no charge for either the primary earner or the spouse for Medicare Part A. However, it becomes a problem if the primary earner is single and after 7 or 8 years they decide to raise a family and they never go back to work, because they can't accumulate 40 quarters of credit, that's 10 years, if they've only worked 7 or 8. So what happens if that happens? Well, there's a charge on Medicare Part A, because Medicare Part A is paid for by your contribution to Medicare from your paycheck. But if you're not making 10 years worth of contributions, well, that is the minimum threshold. So let's just say that you work 8 years. That's 4 quarters a year times 8 years. That's 32 quarters. That's not 40, so you haven't hit the minimum. There's a charge for folks that have between 30 and 39 credits. That charge in 2026 is $311. That's a $26 increase from 2025. And what if it's 7 years instead of 8? So that's 28 credits. Well, if you have less than 30 credits, that charge goes up to $565 per month. That's a $47 increase from 2025. So if you are just shy of 40 credits, it might be worth going back to work at least part-time to get up to that level of 40. Now let's talk about the Part A deductible. In 2025, it was $1,676 per benefit period. In 2026, it's $1,736 per benefit period. That's a $60 change and a 3.6% increase year over year. Now, I use the term per benefit period, not per year. What does per benefit period mean? A benefit period begins the day you're admitted to a hospital or skilled nursing facility and ends after you've been out of the hospital or facility for 60 consecutive days. What that basically means is that if you're admitted to the hospital several times in a given year, you could have several Part A deductibles. But that also represents the coinsurance for the first 60 days. So there isn't an additional coinsurance for days 1 through 60. The daily coinsurance for days 61 through 90 was $419 in 2025. In 2026, it's $434. So that's a $15 increase, which again is 3.6% year over year. Beyond 90 days, you have what are called lifetime reserve days, and you get 60 of them in your life. Your coinsurance for your lifetime reserve days in 2025 was $838 per day. In 2026, it's $868 per day. That's a $30 per day change. Again, 3.6%. Next up is the skilled nursing facility daily cost. In 2025, there was no charge beyond the Part A deductible. The same holds true in 2026. Days 21 through 100, the daily cost in 2025 was $209.50. In 2026, that increased to $217. That's an $8.50 increase, again 3.6%. So what you're seeing with Medicare Part A is a 3.6% increase in hospital-related costs. And actually, if you look at medical inflation for hospital costs, that's about right. And one final point before we move on, what happens after you max out your lifetime reserve costs? Well, then it is 100% your cost, and that is between $2,000 on average, $2,000 and $5,000 per day. Let's move on to Medicare Part B. This is the medical portion of Original Medicare. Medicare Part B covers outpatient care, doctor visits, specialist visits, preventative services, lab work, imaging, durable medical equipment, ambulance services, outpatient surgery, and the professional fees of doctors, even when you're an inpatient. Part B helps pay for medically necessary and preventative care, and it typically requires a monthly premium and an annual deductible, and 20% coinsurance for most services. The premium for Medicare Part B was $185 in 2025. That increased to $202.90 in 2026. That's a $17.90 change and a 9.7% increase. The annual deductible in 2025 was $257, and that increased to $283 in 2026. That's a $26 increase and a 10.9% increase, respectively. And the Social Security cost of living adjustment was 2.8% in 2026. So on the one hand, you have a premium increase of 9.7% and a deductible increase of 10.1%. And on the other, you have an offset of Social Security's cost of living adjustment of only 2.8%. Now, historically, the increase in Medicare Part B premium has been higher than the cost of living adjustment. Historically, it's been about 5-6%, whereas the cost of living adjustment has been between 2 and 3% in most years. So why is there a bigger cost increase this year than in previous years? Well, one of the reasons is because there is more mandated coverage. For example, there's a cap on drug costs, which we'll talk about in just a couple of minutes. But beyond that, there is regulation, which is making sure that there aren't behaviors at insurance companies that shouldn't be there. Now, what am I talking about? Referrals and pre-certifications. There's been an increased scrutiny on insurance companies to make sure that they're not slowing the process, particularly with Medicare Advantage plans, around pre-certifications. So when insurance companies are paying out more, costs go up. Now, $202.90 is the Medicare Part B premium that 92% of folks will pay. But unlike the zero cost for Medicare Part A, which is based on work credits, Part B's premium is based on modified adjusted gross income. And there's a concept called IRMAA. Now, what is IRMAA? IRMAA is the income-related monthly adjustment amount. IRMAA is an extra charge added to Medicare Part B and Part D premiums for people with higher incomes. It's essentially a surcharge from modified adjusted gross income from 2 years ago. The next question people ask is, what is modified adjusted gross income? It's adjusted gross income plus tax-exempt interest, and adjusted gross income is wages, taxable Social Security benefits, traditional IRA withdrawals, 401k, 403b, TSP withdrawals, dividends, interest income, capital gains, rental income, business income, unemployment income, pensions, and annuities. So basically, any income that you receive that's taxable. And if you're single, this is the schedule for the IRMAA charge for the Part B premium. This affects about 8% of people out there. If your modified adjusted gross income is between 0 and 109,000, there is no surcharge. Between 109,000 and 137,000, your surcharge is $81.20. Between 137,000 and 171,000, your surcharge is $202.90. 171,000 and 205,000, your surcharge is $324.60. Greater than 205,000 but less than 500,000, your surcharge is $446.30. And $500,000 plus, your surcharge is $487. But what if you're married, filing jointly? Well, there's a surcharge for each person as well, but the income thresholds are higher. If your modified adjusted gross income is between 0 and 218,000, there is no surcharge. If your modified adjusted gross income is greater than 218,000 up to 274,000, the surcharge is $81.20 per person. Greater than 274,000 up to 342,000, the surcharge is $202.90 a person. Greater than 342,000 up to $410,000, the surcharge is $324.60. Greater than 410,000 but less than $750,000, the surcharge is $446.30. And a modified adjusted gross income of $750,000 or more, the surcharge is $487 per person. Gang, between now and December 7th, we are in the Medicare annual enrollment period. And it's looking like 2026 is going to see some pretty significant premium increases across plans, and there will be 1.2 million people, according to the Wall Street Journal, which will lose coverage altogether. On this channel, we have only 3 affiliate relationships. One is our trusted Medicare partner, Chapter. Chapter is a Medicare advisor that has access to all plans nationwide. They save their clients an average of about $1,100 per year. They're totally free to you, and the review takes about 20 minutes. If you're on the right plan, they'll tell you, and if you're not, they'll help you switch. So if this is of interest to you, give them a call at 440-703-1224 to see if they can help. Now let's talk about Medicare Part D. Medicare Part D is prescription drug coverage that is administered by private insurance companies approved by Medicare. All plans follow Medicare rules and have a formulary, which means that they differ in the specific drugs that they cover, what they charge, and their pharmacy networks. Part D plans include premiums, deductibles, copays, and a yearly cap on out-of-pocket costs. In 2025, that cap was $2,000. In 2026, it's $2,100. That is only for drugs that are on the formulary. So when you're choosing your Part D plan, it's important that you choose one where your drugs are on the formulary. Because one plan can have basic and expensive drugs on its formulary, and another can have reasonably expensive drugs on its formulary, and there's a cap, that means that the premiums vary wildly from plan to plan, from insurance company to insurance company. Some plans can be as little as $0, depending on the drugs that are on the plan. Others can be very expensive. And getting trend information on plans is difficult because insurance companies change their formula every year. But what isn't difficult is the IRMAA charge for plans based on income. If you're single and you have an income between 0 and 109,000, there is no IRMAA charge. Between 109,000 and 137,000, the charge is $14.50 per month. 137,000 to 171, it's $37.50 per month. Greater than 171 up to 205,000, it's $60.40 per month. Greater than 205,000 but less than 500,000, $83.30 per month. And $500,000 or more, $91 per month. For couples that are married filing jointly, the surcharge per person is, for a modified adjusted gross income between 0 and 218,000, there is no surcharge. Greater than 218,000 up to $274,000, it's $14.50 per month per person. Greater than 274,000 up to 342,000, $37.50 per month per person. Greater than 342,000 up to 410,000, $60.40 per month. Greater than 410,000 but less than 750,000, $83.30 per month. $750,000 or more, $91 per month. Next up is trends in Medigap and Medicare Advantage plans, and we're going to use Medigap Plan G because this is one of the most popular plans out there. It's important to note that premiums vary from region to region. You can have one that's very inexpensive and another, like, say, South Florida, which has a high concentration of retirees. It can be quite expensive. But the data we're seeing for 2026 is that the increases for Medigap Plan G seem to be between 8 and 12% year over year. And if you think about how Medicare Part B premiums and deductible went up approximately 10%, this seems to fit with the increase in Plan G. One final point on this: even though the average seems to be between 8 and 12% year over year, Some areas actually went down because medical claims were lower or some other reason. The big trends, though, are what's happening in Medicare Advantage plans. Medigap is pretty easy to compare because coverage does not change from provider to provider. They all follow the same schedules and the same payments. But Medicare Advantage, there's a lot of activity this year for 2026. First off, about 54% of Medicare eligible beneficiaries are enrolled in Medicare Advantage plans in 2025. This is flat from 54% in 2024, but it's actually expected to reverse direction in 2026 for the first time in 15 years, according to the CMS. In fact, the data shows that it might dip below 50% for 2026. In 2025, three major insurance companies accounted for about 58% of all Medicare Advantage plans. In 2024, there were four. So what are Medicare Advantage plans doing? Well, in order to manage costs, they're raising premiums, of course, but they're also reducing or eliminating benefits that are nice to have, but not necessarily a core mandate of Medicare. I'm talking about hearing aids, I'm talking about dental, I'm talking about health club memberships, grocery cards, etc. What does this mean for you? Carefully evaluate your Medicare Advantage plan every single year because coverage does change. Doctors go in and out of networks, hospitals go in and out of networks, other providers go in and out of networks, and what you had one year may not be the same thing that you have in the subsequent year. And very importantly, speak to a qualified Medicare advisor who has access to a broad array of options. If you like this video, check out that video, 5 Big Changes to Social Security in 2026. And if you have questions about Medicare, give our trusted partner Chapter a call at 440-703-1224 to see if they can help. This is Jeff Schmidt, and I will see you in that video right there.